Hey guys, my name's Dan. I'm a veterinarian. Welcome to the video. Today I'm talking about claw or toe cancer in the dog. This is definitely something I see regularly, probably at least once a month. Yeah, I see it a lot. So what happens, guys, is, dogs can have cancer anywhere, and they can have all kinds of different cancers. Round cell, mesenchymal, carcinomas, lymphomas, all kinds of stuff. Now, toe cancers or claw cancers, we do see these pretty regularly. And what they look like is the claw itself will appear to be hollowed out. It'll be almost like a shell of its old self. And the toe itself will be huge. I mean, these toes, they get big. The dog may or may not limp on it, it's hard to say, but these toes get pretty big and they're painful, and the claw, it just keeps growing and it looks like a dead tree trunk. It just looks funny. What a veterinarian is going to do, guys, is two things. They can do more, but two things are big. One, they're going to x-ray it, and we want to see if what's going on is destroying the bone. Now, of course, infection could destroy the bone too, but we'll get to that in 1 second. The cancer can destroy the toes. So in the claw, in the toe, you're going to have a finger almost, just like me and you. And these digits go into one goes into the claw a little ways. And if the claw has cancer, it's going to eat it away. You're going to get lytic changes to the bone. And it may crawl all the way up. And at some point, it should stop, and you should have normal bones again. So you should, talking about a front foot, let's say. You have your digits, and then you have your metacarpal bones and your carpal bones, just like me and you. So if it's growing the way up, we need to stop it, of course. Once we do the x-ray and we see that, this is a lot of soft tissue swelling, but also it's eating away the bone, we know we have a major problem. Now, we can't rule out infection yet, but we know it's either a really bad infection, because infection can have osteomyelitis, it can eat the bone away, but we want to know if it's actually lytic changes from cancer. So what we're going to do next is we're going to do a sample of it, and we may be able to just do a fine needle where we poke it, and we pull back the cells, and we put them under the microscope, and then we look at it, and if we see cancer cells, we know it's cancer. If we see infection, white blood cells, red blood cells from bleeding, and then a lot of bacteria, cocci or rods, whatever, then we know it's infection. And based on those two things we get, based on the microscope exam, we can say it's cancer or it's infection. If it's an infection, you can totally start treating it first. You may still lose the toe, but you should be treating it first with an antibiotic to try to clean it up a little bit, especially if you do plan on going to surgery. Try to get it as clean as possible. And maybe you can get the toe healthier, but sometimes deep-seated infections need surgery as well. If you poke the toe and you find you have cancer, it's not going to be able to grade it out for you and tell you how bad it is, but it tells you you need to do surgery. So a veterinarian will do some blood work to make sure your dog's healthy. They'll do a chest x-ray to make sure there's nothing in the chest, no mets in the chest, and then they'll go to surgery and cut that toe off. When they look at the x-ray, guys, they're going to see how much of the bone is lytic. So let's say this little digit right here or phalanx is rotten, this one too, but this one's okay. We tend to go on the side of safety, so we'll go beyond the healthy tissue and we'll disarticulate the toe and take it off and suture it all closed. Now, most doggies do really good missing a toe, and that toe goes out to the reference lab, to the board-certified veterinary pathologist, and they will diagnose it for us. Just what it is, prognosis, did we get it all, which is really important, and give us expectations on what to do next. Now, guys, look at a dog's foot. You do have a thumb. Sometimes the thumb is a dew claw. Sometimes it's not there. That's okay. So, boop. But you got to count it still. So you have digit 1, 2, 3, 4, and 5. Now, digit 3 and 4 zoop, are your weight-bearing digits. So these digits are the digits when the dog walks, puts a lot of its weight on. Now, if your veterinarian needs to remove digit 1, 2, or 5, those are non-weight-bearing. Dogs do quite well. They're able to walk around quite well. There's very little limping. There's some limping because we're painful, but there's very little limping. If your veterinarian needs to remove 3 or 4, those are weight-bearing digits. Your doggy may be a little lame for a little bit. It may change their gait a little bit, but they usually do a good job at repositioning how they walk, and they can do a pretty good job, guys, even if we're removing one of the weight-bearing digits, 3 or 4. They do a lot better without cancer on their foot, so it's definitely worth removing if you have to. Alright, guys, if you've ever had a doggy with cancer on their toe, please share it. I'd love to hear about it. I hope all of your doggies and your kitties are happy and healthy, and you are too.